Hello everyone, I'm Dr. Rohit Lamba. I'm a consultant orthopedic surgeon and a joint replacement surgeon working at Sanar International Hospital's Golf Course Road, Gurgaon. So today there's a very important topic I want to talk about, which is osteoporosis. Now osteoporosis has often been referred as a silent pandemic. Silent in the sense that you don't get to know when you get that disease, and then when you get to know about the results of the disease, the problems that come along with it, it's already too late. So, and it is so prevalent in the elderly population in India and in even abroad that it has been a very important factor in the management of orthopedic injuries nowadays. So, first of all, let's understand what osteoporosis is. Osteoporosis is the disease in which you lose the quality of bone in your skeletal system. So it could be anywhere in your skeletal system from the top to bottom, but what it leads to is frequent fragility fractures, which can happen with even a trivial injury, a trivial fall. What you end up with can be a fracture of the spine, a fracture of the wrist, or a fracture of the hip. Either of them can be very debilitating, and the treatment can be a long drawn out one, causing much agony to the patient and the relatives as well. So what are the causes of osteoporosis? The most important one being age. So anyone who's above 45 years of age and someone who has low energy, generalized weakness in the bones, in the muscles, in the body, and for someone who has had a fracture even with a small trivial injury, should be suspected. Find out if the patient has osteoporosis. There is a very simple test called DEXA scan. The DEXA scan can be done. It's a simple machine like an X-ray scanner. It gives you a report within 30 minutes, and it gives you a report according to the same age matched cohorts in your population, which would be considered healthy. So in comparison with that, how good or bad you are, you get a particular number. So if you are minus 2.5 standard deviations below the mean, you would be considered as having osteoporosis. Now, what is the treatment? It's a simple treatment. If treated well enough, or if caught well in advance, you can treat it without any other problems arising out of it. The simple treatment being starting the patient on medications, which would be initially an oral medication which are called bisphosphonates. These are the medicines which increase the bone turnover in your bone and help in making new bone. So the resorption of the bone is slowed down, and formation of new bone is generally sped up, so that helps in strengthening your bone. Similar medicines are there in the form of a nasal spray, which is called calcitonin, that can help in alleviating bone pains out of osteoporosis as well. So in patients who have osteoporosis with a lot of bone pains, we prefer to use calcitonin nasal spray for them. In very severe cases which are resistant to other medications, or if the patient does not tolerate the initial oral medications, two different types of medicines available for that, which are in the injectable format. One is known as teriparatide, which is a recombinant PTH hormone, and the other one is denosumab, which has been a recent addition to the inventory of medicines available to treat osteoporosis. Both of them are usually given by a small injection, which is like an insulin pen, and patient just has to inject under the skin by their own. The teriparatide injection usually needs to be given once every day and for at least 6 months to begin with. In the whole lifetime of a patient, it can be given for up to 2 years. The other injection, the denosumab, can be given once for 6 months, so that is much easier for the patient to use, and the compliance of the patient for the therapy also improves. So these are the usual medications and treatment available for that. Now, a common question would be that anyone can have it. What are the ways and means by which we can prevent the occurrence of this, because this is just such a common problem happening. So all you can do is, when females in their post-menopausal age as in when they attain their menopause, they should get a routine checkup done at the hospital as part of your normal routine health checkup. Those tests are usually enough. If at all something else is needed, your physician would advise you to undergo a DEXA scan, which would definitely tell you for sure how good or bad the strength of your bones is. Then in accordance with that, you start medications. And obviously, if you can avoid smoking, if you can avoid alcohol, that goes a long way in preventing this disease, because these vices definitely decrease your bone strength. Then along with that, patients who have been on steroids for a long time, like patients who are on rheumatoid arthritis, or the ones who are asthmatic who have been taking steroids, oral nasal steroids, they are more prone to developing this. So those patients should also keep a watch that if they are having symptoms, they should consult a doctor and get it diagnosed and start off with the treatment. The other important thing which you can do to prevent is do some weight bearing exercises. So weight bearing exercises would mean if you are able to, you would go for a jog. If not, at least for a walk. So 30 to 45 minutes of walk every day would go a long way in helping to prevent this disease. So these are the mini tips for that. Thank you for listening.